You have probably seen the articles and news about the excellence of the Finnish education system. But what makes this particular model the best? It all starts with the Finns' understanding on how important early childhood years are. Childhood is when all of the core developmental changes take place. The most up-to-date brain research suggests that human learning does not only take place in the brain. What children do plays a role in how they learn. Yet we often think that sitting children down for long periods to study academic subjects will give them a head start. The Finns, however, have decades of scientific proof to the contrary. The Finnish educational system is successful because it recognizes the importance of good teachers throughout a child's school career, and especially during the early years. The model combines emotional intelligence with academic competence and actively encourages the participation of the children themselves. This means that Finnish kids learn through inquiry and play. Hey Schools was founded in partnership with the University of Helsinki. Our aim is to offer the Finnish model to the world. We want to make first-class early childhood education available to as many children as possible. How do we do it? We designed a scalable, easy-to-implement school concept that offers the curriculum, teacher training model, a design concept for the learning environment, as well as carefully selected learning materials. Our mission is to bring up children who are not only capable of adapting to the changing world, but changing the world themselves.
Hi everyone. Welcome to our panel discussion on Students' Practicum in Taska and Tadika in the New Normal, brought to you by SEGI Group of Colleges. My name is Melanie, and I'm the program leader and the Practicum coordinator for the DECE and CECE students here in SEGI Subang Jaya. And together with me is my colleague from the SEGI KL campus, Ms. Kavita.
Hi everyone, I'm Kavita here. I'm from Segi College Kuala Lumpur and I'm leading all the ECE programs in the campus. I coordinate Practicum for diploma and also degree program, and myself and Melanie will be the moderators today for the session. And we thank you so much for joining us this evening. And we are really looking forward for a very productive session. Thank you once again. Okay, I would like to request you all a few things before we go into the session. And the first thing you need to do is, if you are a student taking part in the session, we want you to type 1 in the comment box. Type 2 if you are an owner or the practitioner of the EC setting. Type 3 if you are a parent. I hope you are clear. I repeat one more time. Type 1 if you're a student. Type 2 if you're an owner or a practitioner of the EC setting. And type 3 if you're a parent. During the session, we encourage you to think about a lot of questions because our panel is going to give us a lot of input about the topic today. So think of questions and you're going to type the questions in the comment box. And at the end of the session, we will be looking at your questions and our panel will be answering the questions. Okay, that will happen at the end. And our session today should probably take about an hour and 30 minutes. Okay, please stay with us till the very end of the session because you will get an e-certificate at the end at the end of the webinar. And do note, this session is recorded and may be used by SEGI University and colleges and its subordinates in the future. Okay, are we ready now? If you are ready, could you please use the react button to give a thumbs up so that we will invite our panel. Thank you. Well, are we ready? Looks like, are we ready?
I'm not sure. We haven't got any thumbs up.
Oh,
Let's
okay.
have a
So
see.
let's
Let's have a
wait.
look. I think everybody's typing your 1, 2, or 3, Kavita. That's why. I'm
Oh,
trying to figure out
okay.
which number should I type, 1, 2, or 3. So
Oh,
it's 1 for student, 2 for owners of EC centers, and 3 if you're a parent. Okay. And
okay.
now, are we ready, everybody, to get started? There we see some thumbs up. So it looks like we are ready, Kavita. We are incredibly honored and privileged to have with us 4 distinguished panels on our experience and our experienced experts in their respective fields. But before we pass the floor over to our guest speakers, let us introduce the panel speaker first. So first up, as you can see, is Datuk Dr. Amar Singh. He's a senior consultant and community pediatrician in Perak and a researcher. This is the second time Dr. Amar has graced us with his presence. And as you can see on the slides there, Dr. Amar has an extensive biodata, and here are just some of them. Right, he's the founder and now serves as an advisor to the National Early Childhood Intervention Council. He introduced routine developmental screening for children. Dr. Amma was also the recipient for Outstanding Asia Pediatrician Award in 2012 and the Senior Advocacy Award in 2016. Currently, Dr. Amma is recently retired, and his motto is try to live every day to the fullest. I think that's an excellent motto. I wish I could do that too. Bird watching is something that he likes and fascinates him, but advocating for children is his passion. So welcome, Dr. Amma, and thank you for joining us here today again. All right, the next person that I'd like to present is Miss Karen Tan. Miss Karen Tan is the childcare center operator of My Playpen Childcare Center for the past 10 years. She's a qualified childcare giver and registered with JKM. She also holds dual awards in economy and law, and is currently completing her master's in early childhood from UM. She's also the vice president of the ECC Council. Thank you, Council, for promoting this event. We're very honored that you have done so. Karen's passion lies exclusively with ECCE, and she seeks ways to promote professionalism in the industry. So My Playpen Childcare Center has taken many of our practicum students, and we're very, very happy that she agreed to grace us with her presence. So welcome, Karen. Over to you, Kavita.
Okay. Welcome, Karen and Dr. Amar. I'm here to introduce Baizura from Segi KL. She is in our panel also. Baizura is a lecturer. She is also the program leader for the Faculty of Nursing in Segi College, Kuala Lumpur. She has her bachelor's in nursing, and she has done a master's in education under a sponsorship program. And right now, she is pursuing a PhD in education. She is a registered nurse, and she has worked in University Malaya, the Critical and Trauma Center, before she joined us. And she has experience also working with adults and elderly patients. Taking care of elderly patients is a passion, and Baizura also always gives us guest lectures, and she conducts workshops for our DC and our BAEYE students regarding first aid procedures and also CPR procedures. So we welcome Baizura, and the next person I'm going to introduce is Alamil. Alamil is from Segi College, Sarawak, and she also leads the program program of the Faculty of Law. Alamel has gained tremendous experience in conveyancing practice before she joined the education world. Her areas of interest includes contract law, IT law, and international humanitarian law. She has also completed a number of research that focuses on international crimes and is currently in progress on risk research related to blockchain applications in commercial contracts. Blockchain is something which we talk very, very big in the Industry 4.0. So we welcome Alamil to the session. Over to you, Mel.
All right, so now that we've introduced all four of our panel speakers, without further ado, we shall now pass the floor over to our very first speaker for today, Dr. Amar. And to start the ball rolling with questions, let me start with these three questions. Where do we stand in our current situation, Dr. Amar? How safe are we out there? And how can the early childhood industry continue to support and take on our practicum students? Dr. Amar, you have 30 minutes.
Thank you very much, Melanie and Kavita, and thank you to Sergey for inviting me, especially Caroline for organizing this. Allow me to share some slides with you to answer those questions that have been posed to me. Okay, can you see my slides? Mel? Melanie, Ellen, can see my slides, please? Just say a heads up, give me a heads up, verbally.
Yes, yes. Dr.
Thank you very much. Okay, so I'm going to talk about, focus on two main areas, and I'm happy to take many other questions. I'm going to talk about the COVID reality right now that's happening to us, update you. I'm not going to go to all the basics, but just give you an update. And then I'm going to talk about how to keep our kindergarten safe. And again, I'm going to talk about tightening it rather than talk about basics. I've got a file that I'm circulating to all of you, which talks about how to improve our kindergartens. And I hope that will be shared right now on your Facebooks. But there's a QR code here that you can scan right now to pick it up. Okay, this describes in more detail the measures we can take, and has got some references. The QR code is also on the next slide. Okay, so I'd like to make some key points about what's happening with our COVID-19 situation in Malaysia right now. First, I'm sure all of you recognize that cases are rising rapidly. And if you have not seen today's news, we've gone past 8,000 today, reported numbers. It's important to recognize that reported numbers do not give the full picture. That testing is limited, except perhaps in Selangor State by the Selangor government. And clusters are not our focus anymore. And we look at community spread. Let me explain some of this to you with some data. Now, here's a graph showing where we are going in our country in terms of numbers, and I've taken them in 100,000 blocks. And you can see it took us 1 year to reach 100,000 from the start of the pandemic. Then it only took us 1 month. 1 month in January, 1 month in February, and we went up 100,000. Then we had a slightly tighter MCO, and we had a bit of a pause. And then again, a sort of a relaxation, and this time it only took 22 days to reach the next 100,000. I suspect the next 100,000 for us is going to be under 22 days, probably half a month, we're going to get 100,000. So you can see that the epidemic is escalating. Where is it going to go? This is how it's going to go. This is a trend line. And if I add to this data, this trend line was slightly steeper. I suspect if we carry on unchecked with inadequate measures, then in early June, we're going to hit 10,000. It's important to remember that these are not the full numbers out there. Okay, for every one patient reported, we're probably missing 3 or 4 of them because our testing is inadequate. Okay. So the other issue that is important in this spread is what our Director General of Health has told us, that the vast majority of our infections now are from the community. They're not part of clusters. So although we still have clusters mentioned, and we talk about higher Raya clusters right now, any one time, 50 to 80% of all our current cases are from the community, which means they're unlinked. We don't know where they came from. Of course, they came from someone, but they're not part of a cluster, which means you must recognize that, it could be in anyone, it could be your neighbor, it could be the person you go to buy food from, it could be in any of the universities or colleges that we work in. So I want to say something about our testing. As I said, we probably pick up 25%. Most days we tested only 40 to 70,000. Recently, we've improved our testing. But I want you to look at this figure called the positivity. Our positivity rate is quite high. WHO recommends below 5% to say adequate testing. Currently, our positivity has been going up. If you just compare Sarawak and Selangor, for which we have data, we don't have data for all the states, not provided to us. But you can see Sarawak's positivity is phenomenal. It's 13%. Some days it goes up to 16%. And the testing numbers are small. But if you look at Selangor, the positivity is not that high, and the testing numbers are huge because the Selangor state government is doing a lot of antigen rapid kit testings in the community, offering it to anybody who wants a test. So the amount of testing will determine the numbers that we have. So this is what Selangor state government is doing. Many of us believe that we should be doing about 300 tests right now in this massive outbreak as a means to detect who is infected and as a means to bring the numbers down. Okay. Right. The second point, so this first point, our numbers are going up, they're going up exponentially, they're growing rapidly, and we don't do enough testing. When you see the numbers quoted, like today we see 8,000 plus quoted, then you multiply by a figure of 4 to get perhaps the real numbers out there for that day's reporting. I must also say that, there is some concern that the numbers reported here today may reflect something that's happening a couple of days ago because it takes time for the data to be entered. So we may be seeing a lag in the reporting of cases to us. This includes deaths as well. The second thing is that we all know our ICUs are full, and that means deaths and mortality is going up. At one point we said 9 out of 10 ICUs, now it's almost every ICU beds, and the badly hit places are Melaka, the Klang Valley, Penang, Kelantan, Sarawak, Perak is also bad. Okay. And so a lot of the cardiac care units where we put people who have heart attacks have now been changed to ICUs. And you also must remember, many of the private hospital ICUs in these states are also getting full. So it's not a problem, the Klang Valley alone, it's a problem in most regions in the country, and the health service is slowly getting overrun. We've moved from very few ICU beds used in late March to rapidly, within a month, using up almost all our ICU beds. Okay? And this is what an ICU bed looks like. I think perhaps those of you who don't work in the medical line may not understand. It's quite an expensive bed. You've got a specialized bed. You've got a ventilator, which is quite expensive. You've got a good monitor. You've got multiple perfusers, which gives you drug, and many other equipment. You've got pipe oxygen and gas coming through the system here. And the most important item, the one that's very hard to quantify and the most valuable, is the doctors, the nurses, the medical assistants, the pharmacists, the ones who come. And if you don't have one nurse looking after this person all the time, then the quality of care is not good. So you can imagine when the ICUs are full, what is happening to us? We are using the CCU beds where the care may not be optimal. And we're also now using general beds where we put the ventilator there. But when you put when you use a general bed and put a ventilator there, you don't have all the benefits of all the extra stuff that you have in ICU, and you don't have necessarily one-to-one nursing. And so that pushes our mortality up. So here's our mortality. I broke this up in 500 death groups. And you can see, again, it took 1 year to reach 500 deaths. And then rapidly, this period increased. And in the last month, it took us half a month to get 500. And now it's taking us only 8 to 9 days to get 500. And you can see our death rate, which used to be about 4.4%, is now double to 0.8%. Expect this to rise even further. It might go up to probably 1.5 to 2% because putting somebody in a general bed is not optimal. Okay. Also recognize that deaths have a further lag. It's just not the reporting numbers, but deaths come 2 to 3 weeks after the high peak of numbers. So even if we go down from our peak, we can expect deaths to continue for the next 2 to 3 weeks after that. Okay. Besides the COVID deaths, there's also this problem, which is the non-COVID mortality. Whenever you eat up ICU beds, you diminish them for other people who have got other problems, whether they have cancer or a pneumonia from some other cause, or whether they have an accident, or whether they have a surgical problem. And so, I worry about this. On a normal day when I was working in the Ministry of Health, it's difficult to find a bed. We had to call all over the place to get a bed. So we're always chronically short with bed. Now with ICU beds, even though we've tried to repurpose more beds for them, we're still going to be diminished beds for these individuals. So my colleagues are saying things like this to me. We have extension beds everywhere. It's a war zone we're working in. We have 34 patients waiting to get transferred in. We have 6 patients went to the general ward. And so this is happening in many hospitals throughout Malaysia right now. Even worse, we're starting to do this. This is called triaging. Although it's been played down, it's happening. This is, for example, in the Kedah ICU. Whenever we have not enough beds, painful decisions are made. We hate to make these decisions, but if you ask me, or my colleagues, we have an 80-year-old man here who's got a lot of cardiac problems, diabetes, and he's had a previous stroke, and now you have a 40 or 30-year-old young man with COVID. Both of these people have COVID. Which one will you take if you have only one ICU bed? Generally, I think we will take the younger person. We don't want to ignore the older person, but it's a difficult but a painful decision where we have to make. So the older person will get the general ward and a ventilator, but the younger person will get the better bed in the ICU. And so this kind of triaging is something that we don't wish on any of our colleagues, but it's beginning to happen. The fourth point I'd like to make, besides the numbers are increasing and that our ICU beds are full, and for that reason our deaths are going up, is that we are having a lot of young people dying, increasing numbers. And many are presenting as stage 4 or 5. So COVID has got 5 stages. Stage 1, you're largely asymptomatic. Stage 2, you're mildly symptomatic. Stage 3, you require a bit of oxygen. Stage 4 and 5, and you're very ill. And stage 5, of course, you require ventilation. And if you look at the lighter blue, those are all the recent deaths from people under 60. And you can see it's about 26% of people under 60 who have died recently. And, one of these reasons is perhaps because there's a huge epidemic out there. We only have a certain number of cases that we report every day, and that's why the most severe ones are coming forward, and of course they struggle. Some of these people have no underlying comorbidity. They're not obese. They don't have heart problems. The young people who are fairly well. I want to say that in the next 1 or 2 or 3 weeks, you'll probably see a lot of older people dying because of the triaging effect that I was talking about, and younger people will probably be trying to salvage them. Okay, so we might see a lot more older deaths in the next couple of weeks. So this is what's happening in younger people. The X-ray on the right is a normal X-ray. The X-ray on the left is the one with a COVID pneumonia. COVID doesn't just attack your lungs; it attacks your blood vessels. So it's the blood vessels in your lungs, the blood vessels in your brain, the blood vessels in your heart. So this is what this particular person was under 30, and he died soon after this X-ray was taken. The fifth thing you need to recognize, and one reason why things may be bad, is because we have mutation spreading. We've got now the South African mutation spreading, which is probably the dominant one. We have a UK variant also spreading, but the one of concern is the Indian variant, which has spread very rapidly in many parts of the world, and perhaps is also spreading rapidly with us. I'd like to show you these 2 panels which come from Ministry of Health, showing that in one study in April, this is April, in Kelantan, that out of 10 samples, all were the South African variant. In one study, again in April, in Ipoh, out of 15, 10 were South African variant. So these variants are more aggressive, they spread faster, and they cause more severe illness. So we can anticipate that right now, the vast majority of our spread is South African variant, but the variant that we are worried about taking over from it is probably the Indian variant. And so spreadelia, as Ministry of Health clearly says, hard to detect, cause more severe illness, may even test negative, may have no symptoms, and then suddenly you present very ill and have a higher death rate. So this may explain why our numbers are growing rapidly and our ICU beds are being eaten, and why younger people are getting severe illness right now. So what about vaccines? I can answer more questions about vaccines, but I'll just show you a little bit about vaccines. Right now, we've vaccinated 5% of our population with 1 dose and about 3% with 2 doses. Our vaccine rollout is still slow, but we have very encouraging news yesterday that we're getting more Pfizer vaccines being ordered, and that by June we should receive another 2 million, which is about close to 500,000 a week. And we expect to receive the entire Sinovac supply in June or July, which is good. And we're going to be receiving another close to 1 million plus of AstraZeneca in June and July. So I think this is really going to boost what's happening. And Ministry of Health hopes to ramp up our vaccine, National Vaccine Committee hopes to ramp up our vaccine numbers to 150,000 doses daily. Let me tell you what that means for us. If we can vaccinate 150,000 daily, and hopefully this starts somewhere in the middle of June or early July, the latest, we then can give 4.5 million doses a month, which means we will vaccinate 13+% of the population with 1 dose a month, or about 7% with 2 doses. So in 3 to 4 months, we can reach 50% of the population with 1 dose, or take 7 months to reach 2 doses. I put this out here to tell you that we are not out of the woods yet. We'll have to struggle for more than 7 months. 50% is not enough. Even if you get 50% of the population 2 doses, it's not going to, dampen the epidemic fully. It's still going to keep on growing. So in the next 6 to 8 months, expect that even if we suppress the current peak, we may have another even bigger peak that comes after it. So we'll have to keep other measures going very strongly in this time. So why is all this happening in Malaysia? We've done limited testing over time. We've been slow in ramping up vaccination, mainly because of supply issues. And that's a worldwide problem in many countries. Mutations are spreading. And of course, don't forget, everybody's fatigued. The pandemic has tired us all out, and not everybody is maintaining their SOP all the time. And we have had mass movement of people, even though we tell them not to move, especially during festive periods. Finally, there's been some SOP confusion as we have had a variety of SOPs imposed on us. What is possibly going to happen? The current upsurge in cases will probably peak in 2 weeks from now. That's why I anticipate it may last longer, but it's probably going to take another 2 weeks before we start to see it come down. So 8,000 today probably will reach 10,000, then probably we'll start to see a decline. Sabah and Sarawak, if they celebrate the Gawai and the Kamantan, the Harvest Festival, we then will probably see a later peak. It will carry on longer and probably peak in late June, early July. And I hope what's happening in Sarawak right now, they've imposed an MCO strongly advocating people not to go home for Gawai and not to celebrate Gawai. And I hope people listen to them. So in reality, our quarantine centers are overflowing, and we're going to have to move to home quarantine increasingly. We run out of ICU beds, so we're triaging by chronic illness, and we're going to have to actually grow many, many more beds, but they're not going to be fully ICU competent beds. Will we run out of oxygen? We saw the situation in India. I don't think people recognize that India didn't run out of oxygen. They ran out of oxygen delivery capacity. So at some point, your oxygen tanks, your pipe oxygen, your oxygen concentrators run out, and then you can't give it to an individual. Will we run out of that? I do not know. It depends how high we peak out. But I think NGOs and all should start preparing for this. We mustn't prepare for it when it happens. And finally, of course, we all have an increasing community frustration, and we don't want any unrest in the community. I think we need to work together right now to do this. Okay. I just want to show you what's your risk in case you're thinking about it. If 100 people get infected with COVID in the best of times, so when ICUs are all available to you, 8% will become severe and 3% will be ventilated and 0.8% will die. This is the optimal time. Of course, this severity and the death rate will change with the age of the person and their comorbid. So that's the death rate, 0.5, okay? But I want to point out this thing called long COVID. Many Malaysians don't know long COVID. Long COVID doesn't respect age. It doesn't respect the severity of illness. And currently 1 million people in the UK are estimated to be living with long COVID. This happens to anybody, even they don't get admitted to the hospital, but they have COVID. Your heart, lung, or your brain gets damaged and you struggle for 6 to 8 months, sometimes permanently damaged, not able to go back to work and have great difficulty. Now, if our ICU bed situation worsens, then this mortality, as I said, will go up. So that's the first part, hoping giving you a snapshot. Sometimes I like to simplify it by saying that we have reached where Italy was last year. I don't want us to reach where India is right now. Okay, I'm going to talk about what we can do to tighten our kindergarten. This, of course, applies to early intervention program centers for the disabled, Taskas, schools, and all that. I think the key, and I've shared a document with you for this, and I hope you look at it. The key is to have joint shared responsibility between the centers, the teachers, and parents. And this must be built on trust and discipline, on routines. These are the two key words I think that we must remember. Okay. Now, we need to maintain our basics. And for that, we need the classroom safety bubbles, which means they don't mix with other groups in the same center. I'm not going to talk about the rest of the basics. Okay. I want to say at this point, there's no safe number to meet. Some people say, 10 of us can meet in a small group in a church or a mosque or something. No, there's no such safe number. Go away for thinking of that safe number. So for kindies also, there's no safe number. You need a good safety bubble for it to happen. This is what I've thought about earlier. I've done a session on this, and I'm not going to repeat it. It covers all the different things from temperature checks to environmental safety to surface cleaning to air conditioning and fan, visitor policies, staff meetings, break times, and so on. Of this, the only one I want to remind you again is the class safety bubbles. You must avoid intergroup activities and keep the child linked to their own group and their own teacher. Even the teacher should actually be linked to that group and avoid teacher mingling as well. Okay, and the intra-group activities, of course, we want to limit too much verbal intra-group activities like singing and talking to each other, and even toys may be a vehicle for transmission. Okay, I've got some resources which are in the document that you may want to use if you want going back to the basics. Okay, so let me talk about enhanced measures. What can we do right now to build on the basics for our kindergartens, especially if you want to take practicums, for our taskas? The first message I want to give to you is please improve the quality and fit of the mask. And I'm here speaking to 95% of you. You haven't done it. Please, this applies to teachers, to parents, to students, to everyone. Focus on the filtration capacity, the quality, and the good fit, minimum leak. Now, many of you are using 3-ply surgical masks. They have side leaks at the side, and they don't really, protect you adequately. They're good. They don't. So you need to do something like this. This is the not and tack method, which pushes up the quality of the filtration is good, it pushes up the quality of your leak. It reduces the leak. Okay. The second option is the double masking, where you put a 3-ply surgical mask underneath and put a good cloth mask on top, and that creates a tighter fit. Okay. Both of this has got data for it. Okay. You might add a face shield on top of that. That's up to you. But you cannot use a face shield without a mask. It doesn't make any sense. The data is very clear on that. Early on, we thought children could wear a face shield without a mask, but we now know that that's not useful enough. Now, don't double mask. Don't double mask if you're using other kinds of masks. If you're using an N95 mask, don't double that. Don't double 2 3-ply masks. That's not safe for you as well. So do this. Now, this 3-ply mask also doesn't last for the whole day. Let's be realistic. You got to change it after a couple of hours, maybe 3-4 hours, change the mask and use another one. Once it's a bit more damp, the filtration drops and doesn't work so well. Okay. Here's me. I'm wearing a high-end South Korean mask, which has great filtration. It's almost like N95. The reason I buy this particular mask is because I can reuse it 7 to 10 times with an 75% alcohol spray, and that keeps cleans the mask. I air dry it overnight, and notice I have a face shield as well, because I think contamination is an important vehicle as well. Okay. So the second point, so that's first, improve the quality and fit of your mask. Second, we focus a lot on surface combination. Please continue to do some of it, but it's not the most important thing now. We recognize it's largely an airborne, especially inborn. And it's airborne for hours inborn. The particles may circulate in your room for quite some time. And 1 to 2 meters inside is of no value distancing. So physical distancing is of no value unless you improve ventilation. Sure, give some physical distancing, but the key is to improve ventilation so we can reduce this airborne floating small particles which remain suspended there, which are the viral particles. The bigger ones, the ones linked to your saliva particles, all will drop. It's the smaller ones that remain in the air. Okay, so how to do that? You want to increase fresh air exchange. So the problem is your air conditioning. They're built to recirculate air. So, if you can, turn them off. Okay, if you can't, then, you can leave them on, but open your doors, windows, maybe accept higher temperatures at this time. Avoid a cross draft in your room. That means air blowing in one direction in the room. So it comes from one child to another child. That kind of thing, it's a way, a modus operandi to spread the virus. If you can, put a fan at the window. Long term, I think we should have outward facing, wall fans to suck air out. But a stand fan at the window sucks air out of the room and increases the gas exchange, the fresh air exchange in the room. If you've got a toilet and it's closed up and doesn't have a window, you must keep your exhaust fan all the time while you're at work. Okay? Long term, we need to rethink of our buildings. We need to look at our air conditioning system filters, and we need to probably install window-mounted exhaust fans. But this is for the long term, and you need to think about it. There are people already giving ideas how to do this online. I want to say, even outdoors, please think of your air spaces in Ipoh, coming to a vaccination site. They have no clue of their concept of airspace. I would never get into a crowd like this. This is a recipe of disaster. I notice all of them have got a mask, which is good filtration, but has got a leak at the side that is not fixed. Okay, the average Malaysian. The third point I want to say, I'm still coming back to mask, is don't touch your mask. I see this kind of behavior on the right all the time. People are touching their mask all the time. And then after that, they touch other things. You got to strongly not touch your face or mask. And we need to re-emphasize this. If children are wearing a mask, which a lot of young children know how to wear masks and can wear masks, once they're 4 or 5, some of them begin to wear masks, tell them not to touch their mask. Of course, please, let's not have this nose exposed. And I like this statement, we can potty train a toddler far faster than we can train an adult to keep his nose covered. The fourth point is responsibility of the teachers and the center towards the staff and parents. And I think our responsibility as centers and teachers is to monitor staff. All unwell staff should not come to work and may require COVID testing if they're unwell. I think we should inform all parents and staff immediately if anybody has in the center has contact with someone who is positive. I think we maintain confidentiality the way we tell them. We don't wait. We don't tell them tomorrow. We tell them today. And we must have clear action. We stop that person from coming, from attending, and we test them. We must inform all parents immediately if someone is positive to the center. And of course, then we close the premises. We test all the relevant people in contact with this individual, and we quarantine everybody at home until the testing results are available. If any staff travels out of the work region, goes to another state, goes to another region which may be higher risk and comes back, they should not come to work. They should self-quarantine. We should test them until they're negative, and then they come to work. So these, I think, are the tighter measures that we should be doing right now to to show our responsibility towards our parents. And what about parent responsibility towards us? I think it's a joint responsibility. I think parents must monitor the health of their children and their families, not just the children. Any unwell child must not come to the center. Whether they test or not, I think is something that they will have to decide. And if other family members also become unwell with COVID-like symptoms, then their child should not come until we know better what's happening. They should inform the teachers immediately if any family member or child had contact with someone who is positive. And of course, the action should depend on the situation. The child should not come. If the child's been coming for a couple of days after the contact, then maybe that whole, class bubble should be quarantined and be tested, but the child definitely should defer kindergarten. If the family member is positive or the child is positive, then of course stop attending test, quarantine, and definitely the impact on the kindergarten will be higher. They may have to take one bubble out and quarantine them and test them. Parents who travel our region or children who travel our region, again, should not bring the child back. Even if the parents travel, they should self-quarantine, test, and children should defer kindergarten until the situation is known. And I think this should be routine responsibility from parents. What are our joint responsibilities? I think we all must maintain a home safety bubble. And what does this mean? We maintain good COVID-19 prevention measures at home. We don't go out unnecessarily. We limit contact with other people. We avoid all social and religious gatherings. We preferentially buy back food rather than eat in shops. I haven't eaten in a shop for more than 1 year. I don't plan to for the next 1 year at least. What about flexible teaching methods? I think there's a seventh one here I've got, and that's, I think we need to be flexible. We may move from face-to-face to a hybrid with partial online, partial face, and online teaching. Again, we mustn't be afraid to do this. We must be ready for this. When the situation worsens, we just change. When the situation gets better, we come back to this. Okay. What about practicums, the intern students? I think I want to say that we need practicums. We need childcare educators they're critical for the future of our children. And our children are suffering enormously right now in education. And we cannot have a pause in the training of these students. The minimum we should do is test them before internship. If you can, I think, periodically test them, the resources. How periodic is depending on resources. I think, 2 weekly or monthly if you can. You should limit practicums to maximum to 1 per class. Okay, they should strictly adhere to all the guidelines in your center. And they should limit their travel exposure during internship. During the internship, they should only come to the center, go home, go out to buy food. That's about it. And of course, they should adhere to all the teacher responsibilities I mentioned earlier. Okay. Now, it's pointless to ask teachers or practicum to take measures seriously if parents don't take the same precautions. So I believe that trust bubbles are very important, not just classroom bubbles, not just home bubbles, but trust bubbles between all of us. And kindergartens that have good relationship with parents are the ones that are going to do very well. What about other enhanced measures? I put this at the end here because I wanted to, this is the most difficult. If you had a free hand with vaccination, vaccinate like everybody, every staff, parent, practicum, vaccinate, we can, have a sigh of relief and do a lot more in our kindergartens. But this is optimal. It's not going to happen now. Maybe 3-4 months time, you may begin to see this. I hope they bring kindergartens and teachers on earlier. Realistically, we can push for the vaccination internship before starting. I think some private practice vaccination may begin to appear in the next 2 months. So maybe they could go aboard on this. There's no minimum for this. Huh? Okay, so this will only come probably July onwards even for the realistic one. The rapid antigen testing, I'm not talking PCR here. The rapid antigen testing is what most of us think we should be doing right now. Ideally, we should test everybody weekly. What is testing everybody? Every teacher, every student, every practicum. Okay. In the UK, they're offering lateral flow antigen rapid kits for the public and for the schools and kindergartens and nurseries. They're offering that every 4 days, so twice a week they get tested. FOC from the government. But I think if you can, this is the optimum. Realistically, you test periodically. And minimum, I think you should do, if you want to be realistic, is to test at least monthly, teachers practicum. The bare minimum is to test practicum at the start of the work and test the teachers and the students at the start of the semester. Again, who's going to pick up the bill for this is something that we can talk about, and maybe some of my colleagues can talk about it when we have when they speak soon. Now, do vaccines work? Do all these measures work? Look at UK. They had a crisis last year when they opened schools and all that. And look at them right now. School reopened, start of summer term, and they are settled. They're settled because they're vaccinated more than 60-70% of their population, and they're doing well because of that. They're also doing well because they got huge mass antigen testing in offices, in schools, in other places. I want to end with this particular slide and say that, COVID has impacted us enormously into our lives and our psyche and our jobs. We are worried about the COVID deaths, and some people are worried about the side effects. This dot is too big. I should make it even smaller. I can't on the screen. But that's the serious, damaging side effects about that size. That's an effect of COVID deaths on you. That's a collateral death for people who are going to die because of not COVID, and that's long COVID, which is going to happen to 10 to 30% of people who get it. So keep our classroom safe by having a safety bubble. Have all of us have home safety bubbles, and let's create a trust bubble between us that can see us through this time. Thank you very much for listening to me.
Thank you so much, Dr. Amar, for providing us with some scary facts, I must say, and some truths out there so that we can actually take some responsible routes in our schools and to come up with an informed action plan. Now, we all need to be clear on our respective roles and responsibilities as practicum students, as practicum centers, parents of children, and even training institutions, right? So now I'd like to call upon Ms. Karen as an early childhood operator. How would you like to respond to Dr. Amar and all those key points that he brought out about the early childhood centers? What are you all doing in your center, Karen?
Hi, Melanie. Thank you for having me today. And thank you, Dr. Amar, for the wonderful fact and input. And I really agree with Dr. Amar. He actually brought up these 6 very important keywords, which is joint, share, responsibility, trust, discipline, and routine. And I like the fact that he broke the 3 bubbles, that we have the classroom bubbles, the trust bubbles, and the home bubbles, which is the family bubbles. So what I want to say at this point now, with the rising case of COVID-19, it's very important for operators who are actually operating right now, like me, to understand the risks that we are actually taking when we are operating the center, and the steps that we're taking to actually mitigate the risk. Okay, it's not safe to, at this point, it's actually not safe to actually operate the center, but because there's demand from the parents, there's demand from frontliners to send their children to a safer place while they're at work, we have to open the center. So we on our part as operator, we actually have to take full responsibility. So the first thing for me that's really, really important is actually communication. And communication is not only limited to communicating the SOP to the parents, to your teachers, but it's very important for you to actually communicate to your parents to make them understand that at what position are there in this COVID-19 chain link. So you just don't only communicate your SOP, but to get them to work together with you, they need to understand, if they are infected in the line of infection, Where are they in the link? So that they're able to quickly come back to you and respond to you and say that, oh, I have a colleague. Okay, now I know I'm at, like this position, and I should keep my child at home. Because many times at this point, right, a lot of operators who are operating, they're not sure when they're supposed to open, when they're supposed to close, what they're supposed to do. It's very important that you put all these procedures and these protocols in place. So you need to communicate to the parents what are actually their roles, what they're supposed to do, how are they supposed to keep safe in their bubbles at home, like what Dr. Amma has been mentioning earlier. And you have to communicate clearly to your teachers what is actually expected out of them, and make sure that, all these things, it's practice. So the trust has to come in as well. So know the risk that you're actually taking. And number two is, it's very important to allocate resources in times like this, because if you're operating, you have to allocate resources, especially for testing. So as of now, Dr. Amma was mentioning that the gold standard would actually to have like testing every 4 days or every week, like the ECCE industry in UK. But in Malaysia, I understand that many of us are actually very, very, very limited with our resources. So like for my center, we do testing, routine testing. Recently, we did it once a month, but you cannot just limit to that, because when there's an incident happening, for instance, recently we had an incident in my center where my staff who had a brother-in-law who was infected with COVID, and when that happened, everyone in the bubble had to be tested. So it was like, although we did their routine testing, on top of their routine testing, we had to do another rapid antigen swab test for the whole group. And those are the kind of resources that you have to allocate. You have to know that these are the kind of resources that you have to allocate at times like this, to give your assurance to the parents and to ensure that your center is closed. And if it's so unfortunate, and if there's a case, you have to be ready to close the center to make sure that everybody is safe and things like that. For operators, I know there's a lot of things that you're thinking about, like, how am I going to recoup these losses and things like that. But at this point, I think it's really, really about safety. So testing is actually, at this point of time, because not everybody is able to get vaccine, is actually the way to go. And as I think lately, the cost of testing has come down a little bit. RTK antigen testing is actually not as expensive as it was used before. So if centers are able to do this testing, you are advised to actually do so. So in regards to taking practicum students, so my center, we've been taking practicum students, like, I think in the past year we took about, I think 3 or 4, if I'm not mistaken. And whatever we afford to the practicum students, in terms of like testing, it's in terms of like compliance with SOP and things like that, it's the same as what is expected out of the staff. So this has to be communicated clearly to the practicum student that you're taking in. So prior to coming in, they have to take an RTK swab test. You can actually ask the student to bear the test before they come in. But once they are in, your routine testing should be undertaken by the particular center. That's the case for my center. And if there's any incidences, it's then you as a center should take the responsibility for the particular intern, because the intern or the practicum student is actually under your care. So that is actually, in my opinion. Another thing is that I wanted to say is that it's very important that apart from the communication with the parents, the staff, your staff, it's very important for you to communicate also with the people within your industry, so that you will know as an operator, if there's an outbreak, if there's a case reported in a nearby childcare center or a nearby preschool around your area, you would know what to do and immediately communicate to the parents to tell them to stop sending in their siblings, and to keep their siblings until they have the results are clear, or they have fulfilled the particular quarantine period. So this is actually very important during this particular time. So as an operator, you really, really have to be at the top of your toes, and like I mentioned earlier, communication to parents is very important so that they don't get disgruntled when you say that, oh, sorry, you can't send your child in at this particular time because your child who's a sibling in the other center is affected, so that they understand the severity of the current situation right now and they will cooperate with you. So when you reopen, it's very important for you to actually communicate all these policies to them and tell them that, okay, we're opening during COVID period. This is what you're expected to comply. This is your standard duty of care. On our part, this is our duty of care. This is what we're going to do. If things happen, these are the actions we're going to take. On your side, if things happen, these are the actions we're going to take. On the staff side, these are the actions. And when I say staff, it includes the practicum student. These are the actions that is going to be taken over. So you have to have all these protocols and procedures all clear, and you just send it all out to your parents, your teachers, whoever that's involved. Then it gives them a clearer idea how they can, be proactive when things actually happen. So that's my input on my part. And yeah, like once again, I went through Dr. Amar's notes, and it's fantastic. And I think that all the preschools and childcare centers and the early childhood centers, they should actually practice what is actually being shared on Dr. Amar's notes, because that's actually very, very comprehensive. Melanie? Oh, Kavita.
Thank you, Karen. Yeah, sorry. Thanks a lot, Karen, for such a lovely input. It is very, very useful, especially for the practitioners. And I like especially the things that you shared about the protocols. That's very detailed, and which I think every practicum center must practice this, especially during difficult situations, because we have heard a lot about these protocols and which was not conveyed very well to parents, and because of that both the parents and the children were affected. And it's kind of they also get affected, not only physically, but they feel mentally ill also by hearing a lot of myths and the facts that which is not right and things like that. So protocols will be very, very helpful. Thanks a lot for sharing about that. And you also talked about being proactive, right? Yeah. So being proactive, yeah, each and every one of us, every stakeholder of the earlier setting have to be proactive during this time, rather than being very negative about the situation and trying to back up and things like that. Yeah. Thanks a lot, Karen, for sharing all these points, which will be very useful for all of us, all the stakeholders, I think. And one more point I would like to highlight here is when Karen talked about the resources that we need to get ready with during this time. Yeah. So that also we need to take note. And thank you, Karen, for this. Okay. And I would like to invite Alamel to respond to Dr. Amar's presentation. Can we have Alamil, please?
Hi, Kavita. Thank you. Thank you, everyone.
Hi, Alamil.
Okay. So thank you for joining us today, everyone, for those who have been joining us from all these different platforms. And I want to thank Dr. Amar and Karen for this wonderful sharing that they had on the situation that we have right now. And so we are aware of how the situation has quickly, become worse in this few days. And it is a really saddening situation. But it is even more saddening to see that apart from the rules that we have and everything, people are, can I maybe safely say, ignoring the SOPs most of the time for their own individual wishes, you see. And when we are looking at these SOPs, and in particular for this early childhood industry that we have, it is very important that we also identify where do we stand when it comes to legal positions as well. Because ignoring SOPs while you are visiting some places and so on, that may be one thing, but we do not also want to go against the SOPs that we have while trying to make sure that we run this industry, you see. And so when we are looking at this legal perspective of this entire early childhood situation and the practicum issues that we have, there are a few laws that we should really take note of. And that these laws that I'm referring to are the very important laws that you will frequently see in the SOP documents, okay? And we are looking at this Prevention and Control of Infectious Disease Act 1988, and we also have the Emergency Ordinance 2021. We've got these other regulations that come along with this acts and everything. And so, how does this laws that we have give an impact on how we are running this service in early childhood, and how does this affect on practicum students? And so, like Dr. Amar shared just now, it is all about this joint and shared responsibility towards making sure that the infection rate is brought to a very minimal number. And so, how can we do this? And to explain it clearly to you, let us look at how maybe each party that we have in this situation can do their part, all right? And if we are looking at this, we have got three people, three parties. Okay, in all legal perspective, we've got three parties involved in this entire situation. And we're looking at the center itself, the operators, and we're looking at the students, and we're also looking at the parents and how they can actually put in their part. Now, as childcare center operators, you have to understand that throughout this pandemic, even though that there are certain times where you are not allowed and you are allowed to run your business and everything, you still have to follow the SOPs very strictly, because we are looking at young kids coming into the picture, and we are really we have to be very careful about how this is going to affect them. And in recent numbers, as shared by Dr. Amma, we can see that maybe compared to last year's rates, we can see that young kids were not as affected by this COVID virus. And now we can see that we have more and more cases coming in. And if I'm not mistaken, according to the recent cases that we have, about 50,000 or lesser than that, we've got young kids involved as well. Okay. And so when we are looking at this SOP, following SOPs is really, really crucial. Okay, because we are also understanding based on these SOPs that not complying to these SOPs may carry um, offensive punishments, where you can see that it is either a fine or some period of imprisonment. And while these are maybe to a very minimal amount, it carries equal importance to how you can proceed further from that point. And looking at the students' point of view who are trying to secure internship placements in schools right now, when we are looking at internship opportunities, we can see that throughout the global scenario for this industry, we are facing some difficulties. Students wise, you are definitely facing difficulties because of the consequences. We've had many cases where internship students who join these schools fail to follow the SOP, and the consequences that you suffer. And when you have that kind of situation, it is very highly that employers in childcare centers may not even want to trust, because of the experience and inexperience, and being new to the picture and everything. But what you can do is, if at all you get a position, if at all you can get a placement, then it is highly suggested that you follow SOPs very strictly, because that is what is going to give you the job, right? And in let's say the employers are kind enough or considerate enough to bring you in, then I believe it is equally shared responsibility for both parties. And in situations where, for example, centers have taken in interns, and you are now facing difficulties because of these interns failure to follow the SOP, you have to keep in mind that in terms of employment, interns are not exactly considered as employee per the labor law that we have. And this is because of the very nature of how these people are coming into your positions. These people are actually students and not exactly looking for a permanent um, employment with your operation and centers. And so, because of these reasons and many other reasons where you don't really provide them the equal benefits as your employees, they may not really be entitled as employees. And so, labor law may actually be restricted to most extent. And so, when you have this kind of situation, taking care of interns and the benefits that they get and the actions that you can take against them, all of these are really on your discretion. As center operators, like what Karen said just now, and that her center is actually taking in interns and have done so far for 3 or 4 students, and that whatever cost that comes along with these interns and having them tested for this COVID-19 and these other SOPs to make sure that they follow the SOPs, and whatever cost that comes along with it, it is part of the employer's responsibility. And so this is something that we have to understand, because even though we are taking them in as a temporary employee, and you being a temporary employer, this is the situation that we have. All right. And if at all, some may be even having questions if, let's say, my intern had brought in a positive situation here, and I'm worried that my students or parents are going to be affected in this. So what you can do in that situation is, my advice for the centers is that always try to make sure that communication is there. Please always make sure that your interns or even your employees are always communicating to you about any symptoms that they have, or any particular visits that they've made to these hotspot areas, and that they should be tested frequently, and that you inform this accordingly to the parents as well. Communication is exactly the thing that you need to be very clear of, right? So yeah, that is my perspective, what I think about this entire situation. And as long as you can follow the latest SOP, and I believe there is one latest SOP released on how Tadika and Taska can be operating in this MCO time, specifically this third MCO that we have, I think we all can do it if we are strictly following the SOPs. And so please always make sure that communication is always there, and you make the necessary actions, and that you strictly follow the SOPs. All right. So I think that I can share so far. Thank you, Ms. Kavita. I think I pass it back to you.
Yeah. Yeah. Thanks a lot, Alamil. And we will be moving to Baizura to share her point of view based on Dr. Amar's presentation. Can we have Baizura?
Hi.
Baizura.
Okay, hi. Right. That was a wonderful sharing from Dr. Amma, from Elmel. Okay. So referring to what has been shared by Dr. Amma. Okay. It looks like it looks scary, but yet it's indeed it's truth. Okay. So the numbers are increasing. Okay. We look at the beds in the ICU that are fully equipped, and looking at the healthcare facilities. Okay. They are they need more support. Okay. They are lacking of resources. They need support from each of us to play our role. And then what else? For the looking at the healthcare professional, we know that they are suffering for 2 years already, since I think March 2020. They are suffering. They keep on fighting for us. Okay. So what we need to do for them? We need to play our role. So I think, from my point of view, the institution itself, we need to keep on impart the students with a good and a good knowledge, and also maybe trainings, and also something like communicate to the students awareness. That is the most important thing. And before we started to give deliver anything, the most important thing is the educator itself. I think we should be a role model first. So the educator must be a role model. So then the students, the practicum students, and then people outside there will follow what we has been practiced. Okay. I'm saying about being a role model. So the fundamental to prevent, not to say prevent, but um, to help each of people who are fighting for us. Okay. So what we need to do is we need to the most I think that is the most simple thing that we can do is to keep on safe distance. Okay, so we need to inform the students. Okay, this that is the most important measure to prevent the spread of the virus. And other than that, the college itself, the institution. Other than that, we also impart the knowledge on the important measure where they need to wash and sanitize their hand at all time. Not to say at all time, they need to know when to wash their hand, and um, they need to practice before they inform the students, because the students outside there, people are looking at us. Okay, if we are not practicing them, but we are saying that okay, you must do this, you must do that, but we ourselves are not doing that. So that is not a good role model. Okay.
Yeah.
Other than that is the institution, I can say SEGI. Okay, what we has been doing is we has prepared the students in terms of giving them education, like training, special training. Okay, keep on updating on the new policies, and then what are the things that they can do in terms of okay, like previously, traditionally, okay, the traditional learning is like this. So we need to be flexible. Being flexible in terms of look at the pedagogy of teaching. Okay, your task at school is to deliver the knowledge and share your experience, or share the lesson to the students. So maybe we can change in terms of like virtual learning. Okay, by hook or by crook, we must adapt, we must face it. That is a challenge.
Yeah. Thank you, Baizura. Thanks a lot. Yeah, that was very good sharing. And yeah, let's move on. Yeah. Thanks a lot to all our panel speakers for such insightful sharing. And yeah, we are coming to the most interesting part, Mel. We are here to take all the questions now from our audience, from students, from practitioners, from the owners of the schools. Yeah. Mel, are we ready?
Okay, yes, Kavita. Yes, Kavita. We have got lots of questions, I hope, coming in from our comment box. And please feel free to ask the questions, type your questions in the comment box. so that we can post it here and we will be able to address all the speakers. So now that we're moving on to our question and answer session, maybe we can have all the panel speakers come up and join us on stage. Great. Okay, so right. So we will start with some question. Okay, since the questions haven't come in yet, maybe I shall start with one question for Amar. Can you tell us about the knot and tuck mask that we should have? Because I do see a lot of us wearing our mask in perhaps not the correct way, not realizing that that's actually doing more harm to us, thinking that it's always going to be safe for us. Maybe we can ask the question to you just to start the ball rolling a little bit.
Thanks, Mel. And so basically, when you wear a surgical mask, most of you are using a loop around the ear. If you look at hospital, they don't have that kind of loop. They have a tie. So when you have a tie, you actually can tighten your mask to the extent that you need. The loop doesn't do that. And actually, if you stretch the loop a little bit, actually becomes even looser than you need to. So there's a gap at the side here where air goes in and out, and it should not be there. So Center of Disease Control in the US and many other individuals suggest that actually you tie a knot there, and then you tuck in that bit so that that leak is reduced. It's not 100% reduction, but every bit to protect yourself is important at this time. So that's what we're recommending. Right now, I hardly see even 5% of people doing that. I think we need to get this message out and get it to be the normative way that we wear a 3-ply mask. If you're using a loop, if you're using a tie, that's okay.
Yeah. So one of the questions was a lot of people are starting to buy KN95 masks. Is that something you would recommend for
I
daily
have some.
use? I mean.
Yeah, I have N95 masks, and of course I've used them at work, and I've been through SARS and some of the other epidemics as well. So they're not easy to breathe with. They're very tight. They're good masks. They do a good job, but I'm not sure the majority of you can last in a classroom teaching for 4 or 5 hours. I think even an hour will be tough. So that's why the mask that I wear is slightly different. It's equivalent N95 mask, but it's breathable. But of course, there's always an issue of cost and what people can do. There are good local producers of N95 masks. The Durio company and 3M also do that. So people are buying those. I think you want to keep your N95 mask for the most difficult situation. Let's say you have to do something really difficult. I can't imagine what it is for you, but it could be that maybe you have to enter an office building or something like that. Or you're going for your vaccination, and there's going to mass of people there. Maybe that time you use your N95 mask, but not for your everyday schooling. I think the better way to do it in everyday schooling is to change your 3-ply mask maybe twice while you're teaching in a morning session, or secondly, wear a cloth mask on top to actually tighten the fit. I think that's a better solution than N95 mask, more realistic, functional.
Right. How about Karen? What kind of mask do your teachers use?
So we use the 3-ply mask, and then on top of the 3-ply mask, we actually use the face shield for teaching.
Yeah,
but now I'm actually taking note of what Dr. Amar said, that we have to tighten it, and also or we can put the cloth mask on top of our 3-ply mask, because it's actually very difficult for us to teach with the N95 mask, because we are constantly talking and the children need to listen to us very clearly. So sometimes it's quite it's very difficult to speak under the mask.
For a teacher, could I add? I think that if the face shield inhibits your voice, then maybe consider safety glasses as an option. That you can wrap around, and so it's a mask with the safety glasses. That way, at least your voice is not impeded by an extra. I know when I go and try and tapao food, sometimes they can't hear me very well because of the mask and the face shield.
Yes.
Yeah. And your voice is muffled and you sound kind of like alien-like. That also makes it bad. Okay, so the next question is, do you think early childhood students should learn about the new normal settings in their current studies? Yeah, so is it part of our program? Baizura, you want to take that?
Okay. That is. Thank you for the question. Okay. Yes, that is part of our program from SEGI. So before we let go the student to go for practicum, actually we has impart the student with the some special what I want to say is something like short course where they need to know the mode of transmission first. Okay, so at least they are not worried. Okay, they are not worried. Okay, or they are not misunderstood by reading at the nowadays social media, they keep on spreading news very fast, fake news. So if let's say we are saying that okay, I'm not looking at this news who has spread in the sending me through the WhatsApp, but um 2-3 times, yes. But when it keep on posting to more than 10 times and people keep on forwarding, people keep on trusting on the fake news. So the students, okay, they need to have a very good knowledge, awareness on either this thing is true or not. And if the student is safe, they know, but without sharing their knowledge and giving their opinion, it keep on spreading. So the function we has highlight this to the students and to everyone in at SEGI, like if you know that it's not truth, so stand for it. Don't just keep on ignoring or just saying that it is not true. I'm not looking at it. I will not respond to it. So it will keep on spreading. So the role number one is I think we should uh, keep everyone aware on the do and the don'ts and what is right, what is wrong. I have learned on this, and then if these things happens, what are the consequences, and then if you do this, what are the things can happen. If you do this thing will not happens to you. So we can maintain the
Yeah, can I add on to what Baijora has to say?
yeah.
Yes.
It's
Yeah,
actually
sure,
very
sure.
important for the centers that are taking in these students to actually also educate them by, like what Dr. Amar has said earlier, by being very disciplined in enforcing all these practices, and routinely enforcing them as well, so that they can actually see the importance of this. On top of just telling them what's important is very important for the centers that are taking these practicum students in. Not only practicum students, your own staff, you have to consistently, enforce it on them.
Yeah, yes.
Yeah, thank you. So let's move to the next question. It's from Tenko Maisara. She asks, may I ask, how do we perform the physical activities with the new normal, like in online learning? That's a very interesting question. Would who would like to take this question? Maybe Karen
Maybe
or
Karen,
Dr.
yeah.
Amar? Yeah,
Uh,
Karen.
Well, there's actually a lot of ways that you can do like physical activities online.
Yeah.
Google is a very, very good resource actually. If you just Google how to conduct a physical activity via online teaching, you actually see many, many resources, and there are actually Facebook groups, Instagram groups that they're actually dedicated to actually teach and show teachers the creative way of how these things can be done online. So I suggest that you just start with Google. Everything is just there. Just look for it. It's over there.
Okay. Thank you, Karen. Yeah.
I
next
also always
question.
wondered.
Yeah.
I liked what Dr. Amar said about playing outside, having activities outside without the air condition, having good ventilation. I'd love to encourage more children to be out in the garden and having much more space and room. So I like to advocate that to the students in terms of physical activity. Of course, still trying maintaining some the SOPs of close contact as such. Yes.
Yeah. Yeah.
Okay. So the next one is to Dr. Amar. Okay. So Justina says there are different views about COVID vaccination. I was waiting for that to happen. So does the vaccination protect us from contracting the virus, Sama? You're muted, Amma. You're muted, I think. Are you?
Justina, I do
Yeah.
talks on vaccine, and I've done a full 2-hour talk just discussing the vaccine alone and the problems with it. And let me just summarize things. I think all vaccines have got problems. Everything in life has got problems. If you eat too much rice, you could have some side effects. So vaccines are going to have side effects, and that's the problem people are thinking. But they're rare, maybe 1 in 100,000, but they bother us. The big thing is to see how big COVID is and how COVID can damage us if we get infected, especially when the pandemic grows. So does it protect us from contracting the virus? I think there's still some debate on this. Right now, I think there is evidence that you still might get COVID infection, but there's evidence increasingly showing that you may not transmit the virus anymore, and you don't get sick, you don't get severe illness, and you don't transmit the virus. That's, I think, what the evidence is being clear about. Now, people say that, oh, this may think that this is not a vaccine, but actually think of the vaccine many of you got, which is BCG, the one against TB, okay, which all of you accept as a vaccine. Now, that doesn't protect against TB of the lungs. That protects against TB of the brain and something called miliary TB, which is a very nasty spread TB. As a pediatrician, over the years, I've seen BCG salvage so many children. So many children never got sick. Once you got TB of the brain, you're going to die as a child most of the time. So that has all disappeared from our community. But we still see some people with lung TB. It's got better as people became living in separate houses, don't live so close to each other. So that is also a vaccine. It doesn't actually stop the TB bug from spreading, but it stops the nasty effects of the TB bug. Okay? So similarly, the COVID vaccine prevents severe illness, prevents you from transmitting the disease to many others. And I think that's what's going to dampen our pandemic and move forward. I think people are working towards a better vaccine, but you must remember they produced this one, in record time. I'm very impressed with how fast they produce such a vaccine that is effective. Yes.
Right. I wanted to read out this next question that's from Wen's about how would she complete. The question is, may I know if there is a need to complete a workplace placement during the situation because it's really difficult to find a placement? And what are the considerations of an early childhood center in taking on our practicum students during these periods? Karen, perhaps, would you like to address that question?
As an early childhood practitioner for the past 10 years and being a very strong advocate for professionalization, I feel that, if that particular center is open during the COVID-19 with all SOPs in place and things like that, and you have the capacity to take in an intern, you should take an intern, because we always need a steady stream of new ECCE educators to actually come in. So that has to. Sorry, can I get a question again? I'm a bit forgetful these days. Pregnancy brain. Yeah.
Oh dear. Oh, congratulations. Okay.
Yeah.
So I'll read the question out properly.
Yeah.
Then. May I know if there is a need to complete a work placement during the situation when it's quite difficult to find a placement? So, and also whether placement centers take students during this situation.
Okay, and so on the students' part, they have to complete their placement, whether it's during COVID-19 during this period of the pandemic, or they have to do it after the period of the pandemic. Placements are actually very important, because without placements, they don't have the on-hand experience. Actually, it's like for doctors, you don't want to be seen by a doctor who has never completed their housemanship. You don't want them to actually give you the treatment. You won't be so certain. So it's the same for practitioners as well, or student undergoing practice. They have to do their placement. So it's a both party thing. The industry players, they have to be open to take them in. If you're open during the time of COVID, during the pandemic, then make sure that there are SOPs in place. Make sure that the students are aware of these SOPs, and the students themselves, they have to know that they have to complete this placement. So I don't think that you can actually like skip these placements.
Thank you. Yes, I think that is very true, Karen. The only way for practicum students, any institution for that matter, to put into practice the knowledge that they've gained from their institution is to do their placement, and we really need to have placements that encourage our students to gain the experience that they have. Yes, gain the experience that the practitioners have. Okay, so
Yeah.
let's take another question.
Yeah. Another
17. There's
question.
quite a lot of questions coming in.
Yeah.
Um,
Um,
wow.
yeah.
Okay, yes, this is for Dr.
This
Ahmad.
question is from Joanna. This is to Dr. Amar. The question is, vaccination is only available to 18 and above children, 18 and above, and children are not included at the moment. If and when the COVID-19 saliva analyzer test will be available, would it be prudent to always test the children with this method? And she also says children can be asymptomatic and still spread the virus. Could this be implemented as a policy by the government? What are your thoughts?
Thanks, Joanna, for that question. And please leave it on the screen. I think I need to digest it as we talk.
Yes.
Yeah, I believe that vaccination will come down to at least probably 12, maybe even lower. We cannot achieve herd immunity without vaccinating children. That's a fact. So we won't get on top of this pandemic in any part of the world without adding children to our equation, which you can see is happening in the US and other countries right now. They already included children under 12. So we're waiting for the data and more trials before I think we would do it. Of course, right now we can't even vaccinate our adults. So I think the focus is on our older individuals, then we get back to children. Should we test children all the time? I think there are a couple of issues here. We don't want to make children paranoid. We want a simple test that doesn't damage them too much emotionally. But can we fund it? Can we pay for it? You know, not everybody's parents going to afford it. Not every center can afford it. Is the government going to make this mandatory? I don't think so. I believe that not many governments will do this. UK has been an exception. I think it's spectacular in the way they do it, and some European countries as well are doing that. Definitely children can be asymptomatic. There's data suggesting that a child is more likely to spread the virus in the home than an adult to another adult in the home. Twice as likely. And you remember what LML said earlier, something I missed saying, you know, about 50,000 children in Malaysia already have been infected. So it's a child problem as well. They don't get so ill. The rare child gets very ill and a few may die, but it doesn't mean that they don't add to the spread of this pandemic and we will have to deal with it. So I believe that the way to deal with it long term will be by vaccinating maybe at least up to 12 and maybe down to 8. But routine tests will depend entirely on resources. These tests will become available. Even right now, some of the cheaper antigen tests are becoming available in Malaysia. So it depends on centers' capability. I was very impressed when Karen told me that she actually is testing periodically in her center. I doubt the majority of kindergartens are doing that.
Yes, that's true. It's interesting because I think we need to also kind of know what other practices that the other centers do to kind of help, ensure that everybody's being responsible and taking their own roles in doing what needs to be done. Okay, so let's see what's the next one. Next question from Naomi. Is it possible for schools to loosen the requirement for practicum students? Okay, so Naomi wants to know if doing Tadika placements in Taskas are all right, as many schools are currently closed and there's a lot of time constraint that's evident. I'm not sure who would like to take that question actually.
I can take this question. This
Yes,
would actually
please.
depend on the MQA requirement. But
Absolutely.
for me, we are actually very, very clear because Tadika and Taska deals with a completely different age group. So if you're talking about Taska at 0 to 4 years old, and Tadika is 4, 5, and 6. So you cannot replace the Taska practicum with the Tadika practicum because then you will not get the same experience. So my answer would be no. No, unless
Yeah.
MQA changes it, you know?
Yeah, or unless everybody, both the establishments come under one
Yes,
umbrella,
correct,
Taska
correct.
and
Yes,
Tadika,
yes.
and
Yeah.
that's what
Or
we're hoping
unless
at some point.
there's an institution that has both Taska and Tadika,
Yeah.
but yeah, you cannot replace your Taska practicum with the Tadika practicum.
Yeah, I also think it's very different in terms of what you do in a Taska versus what you do in a Tadika, and that's kind of perhaps the reason why those two placements are necessary.
Okay.
Okay, next one is also to Dr. Amar.
To Dr. Amar, yeah.
Yes, Kavita, you want to get the
From
question?
yeah, from Justin Liu. And he says he wants to know your thoughts on the new initiative mentioned by our health minister recently regarding the self-test kits that can be bought in pharmacies. That can be bought in pharmacies soon, not yet available. Is there evidence showing the efficacy of the test kits themselves, and how would we actually go about regulating and ensuring that people will report their conditions when they unfortunately test positive for COVID?
Okay, a number of questions from Justin there. Thanks, Justin. First of all, there's so many kids in the world right now. So we will have to look at the data for each one of them. So I cannot answer that question. Is the test kit good or not? I want to tell you that even PCRs are only about 70% reliable because it depends when you test. Okay, so similarly, the people who are very good at this have suggested if you do mass testing with these kits, actually you're doing the right thing because you're picking up all the people out there, even though you may not pick everybody up, you're doing things. So I think that kids have a very important place. I believe that if the Ministry of Health allows them in, they will be the ones who validate these kits and make sure that these kits are reliable. So we'll have to trust them on doing that. I share your concern, Justin. Some people now don't want to be tested because they don't want to know they're positive. They don't want to enter a quarantine center, and that's risky. If they're fine at home, it's okay. But you see a number of people are being brought in dead every day, and these may be people who don't want to be tested. Some may say, okay, never mind, I'm old enough. Some may say, oh, I don't like the looks of the. I also don't want to be admitted to the quarantine center, by the way, to be honest. It looks like such a
Quite
mess
scary,
there.
isn't it?
Quite scary, yeah. So if the people test at home, obviously they have a choice whether they want to report or not. Okay? It's going to be a nightmare. I think there's no way we can get on. It's going to be self-responsibility when it comes to all of this. That's why I believe that we need to move back to not just parent and teacher responsibility, community responsibility. If I test positive, I tell the Ministry of Health. Ministry of Health allows me to quarantine in comfort at my home. I give them feedback every day. They cannot give me a call every day. They're swamped. Okay. So I'm the one giving feedback by WhatsApp or something every day. I'm doing all right. Oh, now I think I'm no good. Or I've got a pulse saturation monitor at home and I'm monitoring my oxygen. It's dropped. I need to be in hospital. Or you got a local GP doing that for him. So I think that's the only way we're going to go forward. Right now, community responsibility is not there yet. I think we'll have to grow this. We've got another maybe at least 8 months of hard times before the vaccination starts to kick in.
Can I add something a little bit here, because I see some questions asking about how regulations can go about it, right? So introducing all these new testing kits and other ways to test yourself whether you're positive or not. I think all of this, when you are looking at policy wise, the end end goal is to make sure that you know whether you're positive or not and how you're going to affect the community that you are in. And so when governments are making policies and regulations when it comes to this kind of new methods to test yourself, then it will definitely be something similar as to what we have at the moment, whether it's available to you, whether you can do it on your own, whether you can purchase it, economical wise, all these considerations. And at the end, we're going to look at whether you're positive or not. And if you're positive, then communication. You have to go back to the communication point. You have to make sure that you inform the necessary people and do the necessary SOPs. Lock down yourself on your own. You know how they say lockdown Kandiri, right? So you have to do all these necessary SOPs that they have at present. I don't think there will be much different regulation even if these new test kits are introduced. That's my point, I think.
Yeah.
There's an additional point. If you test positive at home, you got to think of your family also.
Yeah, that's true. And I guess that also is a concern of lots of people, isn't it? Because of it's not just about yourself, it's also about how you're going to affect everybody around you and how it's going to bring trouble to everybody around you as well. So moving along, let's look at the question from Patricia Tay. With the numbers soaring, do you think we should temporarily not have new interns till the numbers drop? I would say no. I would say we should continue to have as many hands as possible, but follow the SOP. So maybe either Karen or Amar, maybe you like to talk about the bubble because that may be a possible way of us ensuring that everybody is responsible and doing what needs to be done about the bubble.
Karen, you want to say
Possible.
something?
Karen.
At the end of the day, right, whether or not a center should take interns or not, it actually depends solely to the particular center. So my answer would be like, you need to know what are the risks that you're taking. For my center, for instance, right now, with the numbers that are so high, the odds of an individual coming in with the COVID-19, it's higher as of right now. So as of right now, we suspend for the next few months, and then we will see how it goes. So when the cases come down and the R0 number comes down, then we can take in the interns and we can do the tests and things like that before we get them in for the placement. So it's actually up to the evaluation based on your particular center, what are the safety protocols you can put in and things like that. And if you do take in an intern, like what Dr. Amar said earlier, the practicum student, they should stay in their bubble. The last 2 interns I had, they stayed only in one group bubble, and they didn't move around. So I think the call has to be on your evaluation in your center.
I would like to add to that. I like something that Karen said earlier. It's not safe to open in this climate right now, and that's true, isn't it? Right now we have a massive epidemic, but because people need to go to work, sometimes essential services don't know where to put the children, so Taskas and Tadikas open, and we understand the service that you provide. If you can open your kindergarten, I think you can take a practicum. That's my thinking.
Because at the end of the correct, because at the end of the day, some of you still take in new staff into during this particular period because you need a new staff to handle a new group or something like that. So what's the difference between taking a practicum student? So you have to make that particular call.
So I think the issue is trust again. This practicum can't on weekends go off and see the boyfriend in another district and then come back. It'll be risky, and a bit of testing. One at the start, and then maybe initially another one, and then if that looks good, stay in your bubble. So maybe that one, the student may be prepared to chip in. Some of the tests right now that can be between $30 to $50. So it's not terribly out of capacity to do so.
Yeah, that's true. And a lot of students also are required to do a testing prior to joining the workforce. I guess that might also be the new norm for anyone who's hiring new people, right?
Yeah. Okay. So we have Dr. Liao here. She has given us a comment. She says, compliance to strict SOPs actually works. Yes, that's what eventually we all were coming to a conclusion to. And she also shares that there was a child who was positive, but he was asymptomatic. No one in the bubble tested positive, but the child did spread to his parents. Yeah, that's a sharing from our Dr. Liao.
Can I add a comment to that for learning purposes? You see, you don't spread so much center because you're all wearing masks. But at home, you don't wear masks. So if you breathe on another person at home, you sleep with them, they're going to get a large viral load. Comes back to our earlier thing about if you're infected at home, you must isolate yourself from everybody else, because if you spend time with them, their infection is worse than yours. You got from the community, they get in the home. In the home, you are passing a larger dose of virus to them, and they become more sick than you. So just bear that in mind.
Okay.
Baseware, another industry. big industry player, has also said, what would your advice be for interns or employees who come into the centers on public transport? Dr. Amar, maybe?
I would say, why don't you carpool right now? Why don't we
Yeah.
all work together? I mean, I believe in this time, it's all of us coming together. Let's forget
Yeah.
about differences. Let's share our resources. So, take turns. Other teachers come and pick each other up. I think that's the way to go. I would avoid public transport as much as possible.
Yes. So you just cannot be sure
Mhm.
as to who has come in and who has
Yeah.
gone and what
Yeah.
sanitization they have done.
Yeah. Okay. Thank you, Dr. Amar. There's another question from Nadira Sahal. May I ask, if a student is doing their practicum during this pandemic, does the student have to pay the RTK test by themselves, or if it will be fully sponsored by the center? Maybe who would like to take this question, Karen or
Yeah. Okay, so
Dr.
for me, prior to the student coming to the center, we'll ask the student to take it 3 days before they come into the center. And it's the same policy we have for staff who are actually traveling interstate. So before the cases spiked, there was, I had one of my staff who needed to get married interstate, but we had all these protocols in place, and we told the staff that if there's a need for you to travel interstate because you need to get married or something like that, then you once you get the permission from the police or whatever, you can go. But when you come back, you have to bear the testing yourself, the RTK, the full RTK swab, nose and nasal and throat swab. So for the new interns, new practicum students that are coming in, we expect them to do the same. But this differs. The policy differs from one center to another center. So these are just things we put in place to mitigate the risk. But once they are in our center and they are working, and for instance, if let's say a colleague of them has a relative that is suspected positive, and we want to take precaution, if everybody there is doing a swab test, antigen test or whatever, then we will cover the intern who's in that particular bubble. So that's our responsibility as an employer towards them. But prior to coming in, we are able to lay down certain conditions for the practicum students. Like, we would like you to do this, and this, and this, and this, including the swab test. So normally before you come in, this is a cost that you probably incur. Some centers subsidize the cost. Some centers give them for free. So it differs from one center to another center.
Yeah,
Okay.
I think that's true. I guess certain centers would have different expectations, different policies, but I do think that everybody needs to be responsible and do the right thing. If students want to go out to their and join a particular center, they need to follow that particular center's requirements. And if they cannot, then they should move to another center or find another one that would allow them to do others. Okay, another question from Justin. He's asking a question out of curiosity. He recently watched something that talked about how wearing masks is actually preventing us from exposing ourselves to bacteria bloom that may actually be helping with fighting the virus. What I wanted to know, what would be the thoughts from General Board be on this matter? About wearing a mask of exposing us?
I think the most of us don't know how to answer this question. That's why I'm answering on your behalf. As far as I know, bacterial bloom is the one that I've read about happening in a water tank or happening in on a petri dish or something like that. So let me say that what's happened, what we have recognized, we've all noticed a drop in influenza because of wearing masks. So obviously the mask has had some beneficial side effects to us. We've noticed a drop in pneumonia in children and adults right across Malaysia and in the world as well because of people wearing masks. So I don't know enough about this bacterial bloom that's supposed to protect us. I got to go and read about it. Justin, I apologize. But I can definitely say that the mask has brought some benefit in preventing other bugs from coming to us, as well as COVID-19, of course.
Right.
Yes.
Well, we seem to be
Okay.
Yeah, sorry,
Yeah.
Kavita.
Okay, so there's another question from Tanjingi. How would you advise and guide parents to educate or guide their children during these difficult times? Understanding parents are also busy with their work, but also carrying their children and their learning progress. So, what is our advice? Who would like to take this question? Amar, would you like to take this question?
Amma has a very different philosophy in life. Amma believes that children deserve our time. That I can never be so busy as a parent that I do not spend time with my child. So I believe COVID-19, one of the side effects is made us wake up as parents to the fact that life is precious and time is precious, and we need to be there for our children. So I think the only busyness that we can really be with is cari makan, the one we have to, to find money for family. But there's a limit to that also. Yeah, you don't want to keep on excessive amounts of money. So if you can get that settled to some degree in your day-to-day life, then cut your TV completely. Cut your handphone screen time. You don't need it except for critical messages or phone calls. Put the rest into your child. Sit with them, lepak with them, play with them, listen to them, talk to them. Just hang out with them. I think they will appreciate this very, very much.
Yeah.
I've seen that. I do that with children when they drop by our home, my wife and I, and they appreciate it. There's so much to say, no one to listen to them. So I think spend time listening to your children. Craft time. Don't think in terms of quality time. Think in terms of quantity time. Quality time is a misnomer. It should be abandoned. Children need quantity time from us as much as we can offer to them. Make simpler meals. Involve your children in your meals. I mean, there are many ways to spend time with your children. Involve them in the housework. Involve them in your meals. Just be with them. That's Ama's outlook.
Yeah.
Ooh, I think
Nice,
this
Dr.
question
Amar.
for.
Yeah.
Thank you. Yeah. Spend time with the children. That's what we want. Yeah. Okay, the next one, I think this is for Karen. Information from the government institutions involving early childhood education, practicum, are all now suspended? Is it? Is that
Yeah.
true? Do we know?
She's just giving us the
Has it
information.
just,
Yeah, she's just
yes,
giving. Yeah, yes, just giving us the information. Yeah.
right.
Did Sagi get
Okay.
the notice as well?
Oh,
The
no.
memo?
No.
We
No, not
we
really.
need to check with the
Because,
regulatory.
Yeah.
Yeah.
yeah. Oh
Yeah.
dear. Well, I
I
guess
think
because the situation is just
Yeah,
getting worse,
yeah,
right?
because of the situation, yeah.
But I think
Yes.
we should lobby once things are better to get them back. Just like, we don't want medical students not to go to school. You hang up people's training, you just delay it and you put it on pause, and
Yeah.
they can't graduate and move forward. And we need these people. We need medical students, pharmacists, educators, and they need their practical to get the skill set.
Yeah.
Yeah. Yeah,
Yeah.
without that, it
But
becomes very difficult to move on. Sorry,
sorry.
Najira.
Actually, same things happen to our nursing students. Actually, during the first phase of MCO, okay, they are restricting the students to go for clinical posting because what um, they highlighted that they want to make sure that the students in a safe are not transmitting the virus and they are not getting the virus. So actually, what the student has been doing for this during the period of time that they should go for the practical, they done not to say nothing, but we has played our part, like keep on practicing with them, simulation or what. But they have a feeling that eagerly want to practice hands on. So these things has made them uh, affect on their mental well-being, where they worry about the future of when they will be
Graduate.
graduated.
Mm.
Yeah.
So
Okay.
they're afraid that I will be maybe I should sit for exam in June. So it will be, they don't know when the pandemic will be end. So
Yeah.
if let's say another 2 years, so maybe they might graduate another 2 years. They might they are worried because everything is unsure.
Yeah.
So during the
We
second phase,
understand.
what we are getting from the hospital is they say, okay, we understand what you are facing, the institution is facing, so they allow us. But the first thing they said, you need to make sure that the students are aware and about the safety measure. Of course,
Right.
our students, we already impart with all the knowledge
Yeah.
about the mode of transmission. They know because
Yeah.
they want to keep themselves protect from any disease, because they want to care for the sick people. So they don't want to get sick. Even
Yeah.
like just now, you're saying traveling using the public transport. Our students also, they are using public transport, but as long as they know how to keep the safety measure, the safe environment, the distance, to protect themselves, that shouldn't be a problem. So now what we are facing now, they're accepting the students, but
This is the
of
nursing
course
students, right?
but of course they has some limitation of number, like instead of receiving previously, they say okay, 7 students they can accept, so they limited the number of students. So I think that should be one of the
Yeah.
maybe the center also
Can do that.
um,
Yeah.
can do
That's
that
right.
Yes,
also.
Yeah.
yes,
Yeah.
yes.
I
Thank you,
think
Bajira.
Karen also,
Yeah,
yeah, I think Karen also said that if you need to kind of
yes.
look at the center and what their requirements are, how they're going to handle that situation.
Yes. Yeah.
Kavita.
Okay. So we have, I think this could be our last question. This from Yuzwan. My school have been going full online classes since Raya break for all children and staff safety. May I ask whether schools should give discounts on children's monthly school fees if they are going full online class? Okay. Who would like to take this question? Maybe
Okay,
Alamir?
I,
Yeah.
I Alamel, or maybe I can
Okay,
address this
Karen?
first.
Yes,
Yeah,
yes.
Karen,
okay.
go first.
So this question has been very popular since the first MCO. Like I said, this is a very subjective question. It really depends on your policy between you and your parents that has been
Yeah.
agreed,
Correct.
and whether you have the resource to give discount or not. So it really differs from one school to another school. Some schools may be able to give 100%. Some schools may be able to give 50%. Some schools, no. But
Right.
look at your policy between you and your parents, and look at your financial resources, whether you're able to do it or not.
Yeah. Yeah.
Okay.
So
Thank
this
you,
is where the
Karen.
policies come in place. Yeah.
I think
The
also
stronger.
in terms of I'm sorry, in terms of also doing online, if you have the resources, using this time where you have these pockets where there's no teaching, everybody needs to stay at home and figure out what they can do. This is the time maybe to kind of get all your resources together and come up with the action plan as such. I
Yes.
think we've got this as your last question. I know we said that was the last question, but one more question has popped up, and I think that's for you.
Yes.
Amar.
Yes.
Oh,
Oh, there's
another
another
one.
one.
Okay, something about
Okay.
platelet. Okay, so um, I'm sorry, the platelet one just disappeared.
I think Cassandra asked about COVID vaccine, Dr. Amar. Her doubt is if she has low platelet counts, can they take AstraZeneca, because she read somewhere with low platelets, higher chances of blood clot. That's
Yeah.
Cassandra's question. Yeah.
Yeah, I think we all need to become more informed. I think that the document you should read right now is the one released by the hematology, group in Malaysia. If you just look up hematology COVID vaccine Malaysia, you will find a link to this document, and then inside there they discuss almost every different disease and condition linked and whether you can vaccinate or not. Generally, if I remember correctly, if your platelets are very low, below 50,000, they are cautious. Below 20,000, definitely they will say no. But if your platelets are borderline, let's say 100,000, then, people will probably say, okay, normal platelet count is, maybe about 300, 400,000 at least. So I think read those guidelines. I wouldn't want to say something prescriptive here without looking at them myself. Okay.
Okay, so I think that's the last question. Um, yeah, I think that's the last question, and maybe we can, if we, for to wrap it up, maybe each of us can wrap up with a sentence, a take home gift for everybody, as such. Can we have just one sentence or two, if we push it? Maybe starting with Amar. Would you like to start first?
Sure, can. I believe what I've said earlier is paramount, that parents must work with teachers and teachers must work with parents. It's a shared responsibility,
Yeah.
and we need to work to building trust. That's what's going to keep our kindergarten together.
Great, thank you. That really was one sentence. Okay, and Karen.
In the operations of your center, always put health and safety priority first. Especially in this time and in this pandemic situation.
Yeah, I think that's important. Okay, and by Zura. Last one
As for
sentence.
myself, I think we have gotten this far. So continue to protect ourselves. Don't depends on others. Don't depends on governments. Don't depends on the centers or anyone. You should responsible for yourself. Keep yourself in a safety mode.
Right, great.
Yes.
And
Great.
Alamel, the
Mm-mm.
last one, the last of the four speakers.
Okay.
Last but not
Um,
least, huh?
so I think it all starts with us because it is about us. And the laws are there for a reason, because even if we don't do the part ourselves for us, then that's where the law comes in to save us. So be mindful of everything that's happening around you, and always follow and do whatever that is necessary. Stay safe, everyone.
Thank you.
Thank you, Alamil. Yeah. Thanks a lot to all our panelists for giving us such a wonderful session. And it was so insightful. We have learned a lot. Our students have definitely learned a lot. And yeah, Mel,
Yeah, and also I think we've all taken back some really constructive input. We need to put it into practice now, and hopefully get an answer to our practicum students and how they are going to be in the practice, right?
yeah, we are going to share the last slide now, where you have to do the QR code and you can download your e-certificate. Don't forget that, students and everyone who's taking part. Yeah. So we have come to the end of today's session. So on behalf of SEGI Group of Colleges, we would like to thank all of you for joining our session today. Stay connected, and we look forward to seeing you again next time. Thanks a lot. One
Thank
more
you.
time.
Thank
Yeah.
you. Thank you very much.
Thank
Bye.
you.
Okay, and this is the QR code coming up next.
Yep. Okay.
Thank you, everybody. Keep safe.
Yeah. Yeah. Keep safe. Yeah. All of you. Thank you.
You have probably seen the articles and news about the excellence of the Finnish education system. But what makes this particular model the best? It all starts with the Finns' understanding on how important early childhood years are. Childhood is when all of the core developmental changes take place. The most up-to-date brain research suggests that human learning does not only take place in the brain. What children do plays a role in how they learn. Yet we often think that sitting children down for long periods to study academic subjects will give them a head start. The Finns, however, have decades of scientific proof to the contrary. The Finnish educational system is successful because it recognizes the importance of good teachers throughout a child's school career, and especially during the early years. The model combines emotional intelligence with academic competence and actively encourages the participation of the children themselves. This means that Finnish kids learn through inquiry and play. Hey Schools was founded in partnership with the University of Helsinki. Our aim is to offer the Finnish model to the world. We want to make first-class early childhood education available to as many children as possible. How do we do it? We designed a scalable, easy-to-implement school concept that offers the curriculum, teacher training model, a design concept for the learning environment, as well as carefully selected learning materials. Our mission is to bring up children who are not only capable of adapting to the changing world, but changing the world themselves.